Welkom welkom terug bij de internationale inspiratie vandaag op de Voor de Jeugd Dag. Mijn naam is Caroline Vink van het Nederlands Jeugdinstituut. En ook vandaag willen we jullie meenemen in kennis en inspiratie uit het buitenland. Het thema mentaal welbevinden, waar we het vandaag over hebben, dat is natuurlijk ook een thema in de landen om ons heen. En ik denk dat het ook interessant is om daarvan kennis te nemen en vooral ook iets mee te nemen voor wat we weer kunnen gebruiken in Nederland. En ik had vanochtend al gezegd voor wie erbij was, er zijn door de WHO 2 gidslanden aangewezen die eigenlijk heel goed doen als het gaat om preventie en om de promotie van mental health, dus mental health promotion. En dat zijn Finland en IJsland. Vanochtend hebben we al wat gehoord van Finland en vandaag gaan we vanmiddag gaan we naar IJsland. En daarvoor ga ik ook verder in het Engels, want deze verdere sessie is in het Engels. Because I would like to welcome Sigrun Danielsdottir. We also have never met in person, but I'm very happy that you're with us through this modern technology and that you will take us through your story of mental health promotion in Iceland. And I think it will be very interesting for us to listen to Sigrun. She is a psychologist and a project manager on mental health promotion at the Directorate of Health in Iceland. And I'm very interested in your story. So Sigrun, welcome and happy you're here.
Thank you so much for inviting me. And it's my great pleasure to be here and tell you a little bit about what we have been doing in Iceland when it comes to school mental health promotion. Just to begin with, to orient the audience in the Icelandic situation. So we are about 100 square mile island in the North Atlantic. We have about 360,000 people, but the number is rising continuously. So it's about this number of people. 69 municipalities, 30 upper secondary schools, 170 compulsory schools or primary schools, and 240 preschools. So Iceland is a small country when you look at the number of schools and the number of people. At the Directorate of Health, we have been working with the health promoting schools and health promoting communities model, where we work with schools or with municipalities when it comes to communities in implementing a health promoting environment. And we have about a third of the Icelandic preschools participating in this model, 2/3 of the primary schools or compulsory level schools, and all of the 30 upper secondary schools in the country. And we look at this as a part of a larger umbrella of creating an environment that fosters health and well-being, where we work from the individual level and up to the entire socioeconomic and cultural conditions that have so much to do with our opportunities for health and well-being. But regarding mental health promotion in schools particularly, this derives from two major premises. The first is that mental health is not created by the healthcare system. It's created in the settings where we work, live, and play throughout our entire life. And second, the foundation of good mental health is laid in youth. So about 75% of all mental health problems have already arrived when people reach young adulthood or about 25 years of age, half of it has already surfaced before the age of 15. So the childhood years are really a special time in our lives where we have a unique opportunity to build mental health. But of course, that is a process that lasts a lifetime. So because of this, mental health is created in everyday life settings, and the optimal time to create or to build the blocks for good mental health is in youth. That's why we have focused so much on schools, because schools are the only venue that we have in society where all of the children in society can be encountered. Also, difficulties in behavior, emotional problems, social skills, etc., negatively affect learning at the individual level. And collectively, these problems also create problems at the school level for other students, for the school climate, for staff. So it's in everybody's best interest that we focus especially on mental health in schools. And when we talk about mental health promotion in schools, we're not talking about changing schools into treatment facilities. We are talking about the first level here, as you can see on the slide, where we are. If we use the analogy of swimming, we are talking about teaching people how to swim, helping them to learn to enjoy swimming, help them if they are having special difficulties in learning how to swim with extra support, and catching them if they still don't manage to learn how to swim before they encounter the waterfall. So we're not talking about the treatment phase in the school, but we are talking about the learning phase. So what is social and emotional learning? That is the term that we usually talk about when we are talking about the learning part of mental health promotion. So social and emotional learning, or SEL, is the process through which children, and of course adults as well, understand and manage emotions, set and achieve positive goals, feel and show empathy for others, establish and maintain positive relationships, and make responsible decisions. So this is just a definition of what is meant by social and emotional learning. But what we are really talking about is the skills that we need to navigate life in a good way. And there's much to gain to teach these skills to children from the early age. We have a lot of research accumulating now that shows that when we are teaching these skills to children over a long period, we see improvements in student behavior, of course, increases in social and emotional skills. We see increases in academic performance, decreases in alcohol and substance use, and follow-up studies have shown effects for 6 months and up to 18 years. So there really is much to gain here. But we also need to approach this in a systemic fashion. And if we, for example, if we take the analogy of learning how to read, then we would, of course, always want to have reading lessons for all children. But in addition, we need to have extra support for those who are having difficulty in learning how to read, who are having, who are lagging behind their peers, or even those that have diagnosed specific learning disabilities. So we need to have a system that is developed to meet all children at the level where they are and where they would need support. And we also need to do it in a systematic way where we have implemented infrastructure that supports this way of working, that, for example, ensures regular data monitoring and looking at, is what we are doing effective? do we need to do something different? How is this benefiting this child or this age group? So that is what we set out to do in the National Mental Health Policy and Action Plan 2016 to 2020, where one of the actions was to form a working group for school mental health promotion. And the task for this group was to examine the current status of mental health promotion, prevention, and support for students across educational levels in Iceland, and to really find out what are we doing now, what are we doing well, and what do we need to improve. And for this, I see I have, for this we created a survey that was the largest survey of its kind that we have ever implemented in Iceland, where we examined the following components in the school system, both in preschools, in primary schools, and the upper secondary school level. And we got a huge participation in this survey. It was an online survey, it took a lot of time to answer. We wanted each school to form like a group of different professionals and teachers to answer the survey together. So in light of the trouble that we were asking the schools to go through to answer this survey, it was amazing that we got 70% of all preschools and primary schools in Iceland to answer, and 100% of the upper secondary schools who replied to this survey. And we were asking about these 10 different components of school mental health promotion. And since we have not a lot of time today, I will just go rather quickly through some of the results. But then you can always email me, or you can ask about it later when we have the Q&A in this session today, if you want to have a more in-depth information about this survey and how it was done and what other findings we got. But what we found, for example, when we looked at the school policy and practices, we were looking at things like, does the school have a clear vision and policy in developing a learning community that supports student and staff well-being? And if you have this kind of policy or vision, is it reflected in everyday activities? Is there infrastructure, like I mentioned earlier, in place in the school? For example, do you have defined procedures, teams, etc., that support this work? Do the school administrators regard it as their primary role to promote staff and student well-being? And do they foster a sense of staff collaboration when it comes to supporting student well-being? And our results showed that when it came to school leadership, the role of the school administrators, everybody was pretty happy about this. And just to mention that the school administrators themselves did not answer the survey, so it was only the staff. So we can be pretty sure about these results, that they actually reflect the reality. However, when it came to policy, infrastructure, teamwork, implementation strategies, we had a much lower percentage. So you see that the blue bars are the preschools, the red bars are the primary schools, and the green bars are the secondary schools. When we asked about the school environment, we were looking at things like noise level, group sizes, classroom spaces, but also staff turnover, shortage of staff, and things like this. And there we also saw that basically when you look at the upper secondary school level, so this is the level for like 16 to 19-year-old youth, this is not much of a problem. Usually things are pretty good in this school level. But when you look at the blue preschool levels, and especially the red primary school levels, you can see that there was a lot of shortage when it came to class sizes, air quality, noise level, and at these school levels, the staff turnover and the staff shortage was a huge problem. So this, of course, also affects how staff and students feel at the school. If there is, for example, always new staff, it's difficult to foster a sense of community and closeness. However, when we looked at specifically the school connectedness factor, if the school makes everyone feel welcome, if there is a focus on fostering trust and positive relationships between students and staff, that the students are respected and heard, and if they are measuring this, this is the area where we found the most positive results overall. So we can see that in Iceland there is a very big emphasis placed on school connectedness and on the relationship between students and staff. When we asked about the learning factor, are we teaching social and emotional skills in schools? We also found interesting results where we saw that the most emphasis on this type of learning is made in preschool. So the blue bars here are usually the highest. There is less emphasis when you come to primary school, and when you're in upper secondary school, there is very little emphasis on teaching these kinds of skills. So we saw that here we need to make major improvements if we want social and emotional skills to become systematically taught the way that we teach math or English or something else in schools. And finally, when we asked about assessment and student support, we were looking at how are the schools collecting data, what are they doing with the data, are they measuring mental health or mental well-being, school climate, things like that. And do students have adequate support to be able to learn in an effective way and feel good at schools? Are there clear procedures for staff when you have to refer students for extra assistance and things like that? And here we also found a lot of areas for improvement. For example, here in the first section, we asked about, does every student that needs support in order to be able to learn in an effective manner, do they receive like an individualized plan on how the school is going to meet their needs? And almost 80% of preschools do this. But when it comes to primary school, it's less than 60% and only 30% when you come to upper secondary school. We asked if the individualized plans are made in collaboration with the student and parents if the student is underage. And here you can see that usually this is done in preschool, but in primary and secondary school, it's about in half of the schools. We also asked if there were special people in the school that would manage this students' affairs to make sure that they are getting the support that they are entitled to, if they are guiding other staff in how to meet the student needs. And usually this is, as you can see, for example, with the upper secondary and the primary schools, it's about 50% and 40% that say that they do this. So from this survey, we, the steering group made a number of recommendations to the government. So one was to strengthen the infrastructure of the educational system in order to promote and prevent mental health in a more systematic way. To improve the school environment in pre and primary schools, to work with the staff shortage, the noise level, the group sizes, etc. To work towards systematic capacity building, meaning to go about it in a systematic way to increase knowledge among staff in how to support positive youth behavior, emotional development, social skills, etc. to foster school connectedness, especially in the upper secondary school, where we found that there was less emphasis on this than in the earlier educational levels. To implement social and emotional learning at all educational levels. We really need to start approaching this in the same way that we approach learning how to read and write. We have to teach it throughout our entire educational system. We have to make sure that we are using evidence-based practices for behavior support in schools, to improve organization, provision, and supervision of student support, to make sure that children really are getting the support that they need, that they are not being forgotten in the systems, and that they are lagging behind because they have a certain disability or difficulty. To implement data-based decision-making and regular progress monitoring in schools. So we really need to implement this mentality in the schools that we should always be looking at what we are doing and making sure that it is benefiting the students. And if not, we need to change something. We need to implement something new or work in a different way. And finally, to make better use of the strengths that can be that can come from parental collaboration, especially in the upper secondary school. So in Iceland, we have a really good parental participation in preschool and primary school, but in upper secondary school, it drops a little bit or a lot. So the next steps for our work here is that this action plan was presented to the Minister of Health, which initiated the work because it was a part of the mental health national policy. So even though it is directed at the education system, it comes from the health sector as part of how to promote better mental health among the Icelandic nation. So the action plan was approved by the government. Of course, we at the Directorate of Health will continue to support school mental health promotion through health promoting schools and health promoting communities. But in addition, after the action plan was approved by the government in 2019, last year in 2020, a special steering group was established to follow up on the action plan, to sort of make sure it's not forgotten and to make sure that the actions are moving ahead and that we are implementing them. So the steering group consists of members from the Directorate of Health, the Ministry of Health, the Ministry of Education, the Ministry of Social Affairs, and the Association for Local Authorities. And I'm very happy to be able to tell you that just last Friday, the Minister of Education published a new action plan for her education policy until 2030, where the idea of implementing multi-tiered systems of support, which is the triangle that I showed you earlier, where we have the first level for all of the children, and then we have the second and the third level for children who need extra support, and working with this in a very systematic way. This is among the first items on the agenda for the new education policy and action plan. So that was really terrific to see that, and will I think play a huge role in making sure that these actions are really taken over the next years in Iceland. So that's it for me. I think we are now open to discussions. And if you want to have any more information, you have my email there, and I'm sure the slides can be shared with you.
Yes, thank you, Sigrun. And not just the slides will be shared, actually this whole presentation will be shared, so people are also able to look back at it. But thank you very much for this very interesting presentation. But it does, and there are a few questions from the audience, but just before we go into it, just a question, just maybe you can elaborate a little bit about that, is we also have seen here in the Netherlands, especially during the pandemic, pandemic, that mental health and especially the mental well-being of young people have become really high on the agenda. You could say a policy agenda, like you just told about the plans that have been done. But a question I'm curious about is to what extent, because you also did this very extensive survey among schools and they were very ready to participate in that and to answer that. But how do you look at now the further steps in implementation? Because you have these plans, you have a joint plan from health and education, but are the schools ready and how do they think they will go on about then embracing this further, and have they also indicated what they need for those next steps?
Yes, I think everybody agrees that this needs to happen, but the challenge now is, like you say, how are we going to do it? And in the action plan that the steering group delivered to the government, it is a really long and exhaustive plan. So even though I'm talking about it very in a quick manner now here, it really details a lot of structural changes that need to happen. For example, we need to make sure that we need to create a place in the national curriculum for teaching social and emotional skills. So this needs to be developed into an individual, independent subject, just like math. So we need to define social and emotional learning as a particular subject that you should learn in school. That is one thing. We need to make legal changes to, for example, the role of institutions like the Directorate of Education, make changes to the regulation about school specialist services. So there are a lot of structural, actually, and legal changes that we need to do in order to make sure that this is realized in the system. We need to change teacher education. We need to make sure that if you are learning to become a teacher, that you learn about how to work effectively with behavior, how to support social skills. You should also be able to specialize in mental health promotion, just like you can specialize in being a physical education teacher. You should be able to specialize in becoming a mental health education teacher. So there are a number of really large-scale systematic changes that, of course, need to happen in order for this to be realized. But I think very, very happily in Iceland, we have reached a point where we do agree that it needs to happen.
So you're actually saying a kind of a joint commitment is really a very important factor to make this happen. It's quite interesting because we do have a similar discussion on this in the Netherlands. It was interesting, somebody, Mike, who is listening in, asked if it makes a difference if you are a small country in being able to establish such a big mind shift and introduce such a thing. But then the question, of course, is what is small and what is big. But it was a question from her, because you mentioned the number of schools involved, and I mean, for us, that would be quite overseeable.
Yes, I do think that this is a really important strength that we have in Iceland. Sometimes that we are such a small country. It can also be an obstacle in some other ways, but in this way, I think it makes things easier, and it may make collaboration easier because, yes, there are few people involved. There are few institutions. We don't have to cover like tens and thousands of agents that we need to involve in the work.
That is an interesting point, because does it also then mean that you can get teachers and parents easier on board for such steps? I mean, like, for example, has there been any objections from teachers saying, oh, we're already so overloaded, how can we integrate this into our daily work?
No, not for this, because in this plan, it very much talks about the need for support for teachers. So we all know that this is not going to happen if the teachers are not provided with support from other specialists in the school system. So a major focus is to increase, for example, the participation of school psychologists, school social workers, guidance counselors, specialists in teaching, and so we really need to make the school a more multi-disciplinary venue.
Interesting that you're saying that. I mean, I think we've been hearing that in the Netherlands as well, that, I mean, you should have more different professionals also within the school and helping out. But is that something you can already build on in Iceland, or is that something also that is totally revolutionary and is new? Or
no,
do you already have more a community in the school?
Yeah, we do have a legally defined school support service, but the problem is that it hasn't been functioning the way that the law stipulates. Not all schools have access to it. There are long waiting lists, and so the service is not really functioning the way that it was intended. So it needs to be strengthened, and that is, in fact, one of the main focus points in the new in the action plan for the new education policy. So I think that there is a huge sort of applause for this action among the school staff community. I would think, because this is something that we have heard from teachers and school staff, school administrators for years and years, that they are calling for this.
Mm-hmm. That's interesting you're saying that, because somebody who is listening in the audience, Yamuna, she's also asking how, I mean, that is very much about the staff of the schools, but in to what extent also the pupils and the older students themselves are saying that this is an important issue for them, and have they said, have you gotten any feedback from them how they experience the mental health support in schools?
No, in this particular survey, we were only looking at how is the system working within the school. So we were asking the staff in the school to describe their systems. But we do have regular student surveys in Iceland. Quite a lot of data we have about that. So there are, I think every other year, there is a survey among different age groups where they are asking about mental health, health behavior, substance use, all kinds of different social situations, things like that. And we also, during the COVID period, there were special surveys to the students, asking them about how they felt about the support that they were receiving and things like that. And usually, at least, for example, in the upper secondary schools, which was really the only educational level where we had significant school closings during 2020, the students felt that they were receiving support. I mean, the schools really reached out to the students and make sure that if you need help, that you can contact a guidance counselor or nurse or psychologist or something like that. So I think that part worked well during the COVID period. But I think we and all other nations, of course, also realized that the social environment for children and youth is so important that you can't make up for it just by having access to psychologist support or a guidance counselor or something. It cannot replace the social daily situations that these kids so desperately needed during COVID.
Yeah, it's interesting. And very interesting, and it might be a cultural thing that's happening now, but I see some questions popping up from the audience about sort of feeling that this is a very structured approach and almost like a top-down approach, and like how do you then involve the teachers and the schools themselves in making this happen? And also somebody asked, like, do you involve the young people themselves in shaping then the actual services that you will do? But this is, I think, also a reflection of a lot of discussions that we are having in the Netherlands. And one thing is making very elaborate policies and plans, and the other thing then is the reality of the day-to-day, and how do you make that happen as a community? It's probably not something you have immediately an answer to, but I think that is what I think that's what is popping up also from the way that people are hearing it. There's probably a lot of day-to-day practitioners listening in today as well. Yeah. So I would think, like, if you would present this to Icelandic teachers, how would you get them on board? How would you get them along?
We have presented this a number of times in Iceland to the teacher community, and they are very happy with it. And of course, the survey and the actions that were developed based on the survey results, they all come from the school staff. So it comes from how they responded to the survey, what they believed is a problem, what they believe needs to be rectified. And from there, we created the action plan. So it didn't come from the ministry and down, it came from the staff and up. But then when it comes to the implementation factor, that is the next step. So how do we implement these changes? And there, I would believe that there is continued consultation with the teacher community and for example, the parents' organizations. Throughout the entire process, there has been continuous collaboration with these communities, and that will continue. I couldn't imagine.
Yeah. No, but thank you for emphasizing this, because I think that's coming clear about the culture. And of course, because I'm also looking at the time, there are some questions also, the relation we heard this morning, and we've been hearing that before in the Netherlands, of course, that we have been working on the pilot of the Planet Youth, of the what we call here in the Netherlands the Icelandic provincial model. And there's a lot of people also wondering, is there a relation? Is it in the thoughts maybe that there is a relation? Also because somebody, for example, is mentioning that when you talk about mental health, substance abuse is often an issue as well. So is there something that you would say, like in some ways, that is thinking of this action plan that you're presenting and the Planet Youth model that they're implementing on creating a community and looking at the protective factors and wanting to aim at less substance abuse? Do you see a relation, or is it very much within the Icelandic thinking that is the same focus that you have?
I think that when we talk about sort of the Icelandic model for substance use prevention, at least for us in Iceland, it's this assurance, or this this kind of deep trust that things can change, that we can take a very difficult situation, and we, through collaborative efforts, turn it around. So it gives us, I think, optimism in dealing with other problems. And of course, we know that they have mental health and substance use have a lot of shared risk factors. So through the sort of the Icelandic approach, there has been a lot of emphasis on creating opportunities or equal opportunities for youth to participate in sports and recreational activities, both for developing social skills, for developing their individual abilities to be a part of something, and things like that. And so this would have a protective effect on both mental health and regarding substance use. So I think there's a lot here that we can build on, but it's not necessarily the exact same thing when you are working with substance use versus mental health promotion in general, because especially when it came to the school settings, we are so much focused on building skills. So we want the skills that are necessary for protecting mental health throughout the lifespan to be looked at in the same way that we look at any other skills, that these are really skills that we are not necessarily all born with, but they can be learned, they can be taught, and they can be practiced. And the school, the education system should be the venue for that.
Yeah. Now, I think that message that you're giving us is extremely clear. And I think the relation that was looked at with substance abuse is actually also preventing this. And so I think with that message that you're giving, I think you're basically telling us that looking after your mental health should be just as normal and a part of order day-to-day as brushing our teeth. So I think that is a really important message. And I think this is what just a journey we're just starting on here in the Netherlands as well, where mental health is now having to get a bigger space within the schools, within the school culture. So I think it would be very nice if we could learn together on this in the coming years, and that we could have you here back in a few years to see where you have gone on your journey, and then hopefully in reality and not just all the way on screen from Iceland. So thank you very much, and thank you also thanks to the audience for asking the questions. And your contact will be online, and I'm sure people will be having more questions for you. But thank you very much for being with us today.
Thank you.